I don't even know.
It was funny how they set up the diamonds kind of in one corner. Far corner.
The old one or the new one?
Oh, yeah.
Brand new. Functionally, apparently before it was kind of like the big O's. Terrible concrete. I didn't get to go to the game. Stadium. Yeah, playing fields is 11. Sure. When you walk through the ground level, you're actually on the second level of the stretch. Yeah. You're about 10 feet above the uprights. Ground level. Really? It's pretty cool.
We'll be good to go in just a minute.
Oh, great.
President Obed will speak first, and then Minister Philpott. She'll open it up to questions, and then I think I mentioned we'll have a really hard cutoff at 9:20 for her, but President Obed will be available to stay. Perfect.
Yeah, sure. She's straight right now. Just trying to make sure the agenda. Yeah, it's cozy today. Here we go. Just stand behind.
Good luck, good everyone. Good morning. Thank you for coming. Today we have an important announcement to make around our partnership with the Government of Canada and many other partners to eliminate tuberculosis by the year 2030 in Inuit Nunangat and to reduce the incidence of tuberculosis by 50% by the year 2025. Inuit have had a long history in relation to colonialism and the effects of colonialism in our society. Tuberculosis has been present in Inuit communities since the 1940s in an elevated rate, and we have historical trauma in relation to the treatment of tuberculosis in our communities that then has led to stigma attached to the disease in our communities, but ultimately we have never had a rate in this country that is level with the Canadian rate since the 1940s. Our TB rate currently is approximately 300 times the national average for all other Canadians who are born in Canada, for Inuit and Inuit Nunangat. This rate is unacceptable, and we will work with Minister Philpott and as Minister of Indigenous Services. We'll also work with the Public Health Agency, with Health Canada, with the Government of Canada on a priority basis, as well as with our 4 Inuit land claim regions, Nunavut Government, Makivik Corporation, Nunavut Tungavik Incorporated, and the Inuvialuit Regional Corporation, as well as the public governments that deliver health services within those 4 jurisdictions. Province of Newfoundland and Labrador, the Province of Quebec, and the territories of the Northwest Territories, and Nunavut, through not just a public health approach, but in a priority setting with all partners involved, as one of the key issues that we need to solve in order to create social equity within our communities. We recognize the role that housing plays, the role that nutrition and food security plays, and the role that the reduction of poverty plays in the elimination of tuberculosis. And so we, within our strategy, our elimination strategies that we will create in each of the 4 regions, will address not only the way active TB and latent TB are treated, but also will attempt to encompass the holistic nature of the way in which TB exists and the way in which it's spread, and also the way in which it can be controlled and ultimately eliminated. I am thankful for the partnerships that we've had to date, the investments in Budget 2018 of over $25 million over 5 years for the elimination work that we are about to undertake. I'm also thankful for the TB Elimination Task Group that has been created and is populated by public governments, Inuit organizations, and led by ITK and Indigenous Services. I'd like to call now on Minister Philpott to provide additional remarks around the project that we hope will change this discourse, this narrative on a preventable public health crisis that has existed in our communities for the last 60 to 70 years. Nakamik.
Good morning, Ulakut. Thank you, Natan, for your opening remarks. Bonjour tout le monde. J'aimerais tout d'abord souligner que nous sommes ici sur le territoire traditionnel des peuples algonquins. When Natan Obed spoke this morning, he underlined some of the statistics around the realities of tuberculosis for Inuit. The incidence, as he said, for Inuit in the Inuit homelands in Nunangat is more than 300 times the number of cases of tuberculosis when compared to the Canadian-born non-Indigenous population. And in fact, the rates of tuberculosis for Inuit have increased 1.5 times in the last decade. If you look at a small population like the population of the territory of Nunavut, which is 85% Inuit, the most recent data coming out from 2017 show that in that year there were 100 new active cases of tuberculosis and at least 300 cases of latent tuberculosis. That is why we are very pleased today to be announcing an ambitious goal, a goal for which we are determined to reach, and that is the goal of the elimination of tuberculosis in Inuit Nunangat by the year 2030. And along with that, there are a number of other goals. One of the most important ones is to reduce the incidence of active tuberculosis by at least 50% by the year 2025. This will require a number of initiatives, and we are putting all of the pieces in place. Natan spoke about the long-term funding that will be required for this massive effort of coordination to strengthen the work that's required, both of the clinical work around diagnosis, care, and prevention of tuberculosis, as well as addressing the social determinants of health. Pour atteindre notre objectif, nous devons tous être des chefs de file, conformément au thème de la Journée mondiale de lutte contre la tuberculose. Avis de recherche, chef de file pour un monde exempt de tuberculose. We have put in place a number of initiatives already. We announced very recently the Inuit Tuberculosis Elimination Task Force, which is already well underway. And within that task force, there are regional action plans in place and a growing detailed framework. The detailed framework includes things like community-driven screening for early diagnosis and treatment. There is work to be done around awareness, mental wellness, and addressing the stigma that's associated with tuberculosis. We must address issues like food security, poverty, and overcrowding. There's work to be done on surveillance, and some of the most important work is around the gaps in the health workforce and mobilizing community health workers. But already in the early days of this task force, we are already seeing some successes. In Nunavut, work has already been underway to stand up a mobile clinic, which took place in one community in February. Over 90% of the population eligible for testing were screened in that community over a 6-week period. The results and the lessons from that initiative will inform the ongoing strategy and provide baseline data. We have done work to make sure that availability of medications is not an issue. There is a relatively new medication called rifapentine, which is part of a product called 3HP, which allows short course treatment for latent tuberculosis, taking the treatment course from a 9-month course down to a 12-week course where the person only requires treatment 1 time a week for 12 weeks. We have taken the initiative to add that medication, rifapentine, to the list of drugs for urgent public health needs so that we can access it as needed. We now also have a rapid diagnostic test, which is much more successful, accurate, and rapid than the previous tests. It's called Gene Expert, and it's been in place for the last 5 years in Canada. We have mobilized at least 40 community health workers in Nunavut. As well, in Nunavik, there are now 50 nurses trained so far for the tuberculosis response. There's work being done to promote youth awareness, $25,000 of funding for Nunavik youth to produce videos, educational videos, to raise awareness about tuberculosis. And a field epidemiologist has been mobilized for Nunavik. These are some of the examples of the kinds of things that are happening. As Natan said, there were significant resources in budget 2018, specifically for tuberculosis, $27.5 million over the next 5 years. But in addition to that, over $500 million to work on public health programs, to support the work of the Inuit Health Survey and the research plan that is Inuit-led. There will be investments in housing to address the severe overcrowding and work as well to support jobs and training. Tuberculosis has a long and tragic history amongst Canada's Inuit, and I encourage you, if you have not had opportunity to speak to President Obed about some of the historical wrongs, he and others can describe them to you most eloquently. But we know that there's tremendous trauma that took place from the mass displacement of Inuit to tuberculosis hospitals in the south. You have heard perhaps of the fact that loved ones were buried in unknown locations, and even now many do not know where their loved ones went. We know that children were moved from tuberculosis hospitals directly into residential schools. And we know of many poor policy decisions over the years where efforts to combat tuberculosis were abandoned when the rates started to decline in the 1970s. Les taux actuels plus élevés de tuberculose sont le résultat direct de ces pratiques et politiques. La nouvelle approche du gouvernement du Canada visant la reconnaissance des droits des Autochtones contribuera à changer cette réalité dans l'avenir. This commitment that we're making today for the elimination of tuberculosis in Inuit Nunangat will be done collectively, and it is possible. It should not have taken us so long to get to this day. And I wanted to share with you in closing a quote that I shared the last time that President Obed and I met with the Inuit End Tuberculosis Task Force. I read a quote from a book by a gentleman named Adam Hochschild called Bury the Chains, and he was addressing another great social ill that took place a long time ago, and that was the slave trade that was taking place. And he described what it took for British abolitionists to end the slave trade. He said, and I quote, "The challenge of ending slavery in a world that considered it fully normal was as daunting as it seems today when we challenge the entrenched wrongs of our age. The vast gap between rich and poor, the relentless spread of nuclear weapons, the multiple assaults on the earth, air, and water that must support future generations, the habit of war. None of these problems will be solved overnight, or perhaps even in the 50 years that it took to end British slavery, but they will not be solved at all unless people see them as both outrageous and solvable, just as slavery was felt to be by the people who gathered on that day." So we're gathered here today to say that the reality of tuberculosis in Canada amongst Inuit is outrageous, but it's eminently solvable. And when we work together collaboratively, put our will and our energy behind it together, we believe that we will achieve our goals, and we thank you for your support in this manner. We are open to taking a few questions. I have a limited timeline because I have to get back to the House of Commons, but I wanted to also note that we do have technical experts here, Dr. Tom Wong and Dr. Alvarez from the Canadian Institutes of Health Research, and I believe Natan is available a bit longer than me.
Minister, do we know why or how in this day and age a 14-year-old in Maine would pass away from tuberculosis?
Well, I'm aware that there have been reports about a case that took place very recently in Nunangat. There's still work being done on that, and I'm not in a position where I want to confirm any of the details around that case. But as I said to you, the rates are outrageously high, and young people, teenagers, are getting active tuberculosis in Canada. And the realities are the challenges of stigma sometimes, there are challenges in diagnosis. We're talking often of people that live in remote communities where health workers aren't there, people living in situations of overcrowding. Those aren't necessarily specifics to that case, but those are realities that President Obed and others can affirm to you. This should absolutely not happen. It's an entirely preventable and treatable condition. But the stories of young people dying of tuberculosis in Canada in the 21st century are part of what drives us to this commitment we're making today.
Minister, how did it get to this point, and what led to this outrageous number of 300 times the higher rate of prevalence of TB in the north? What are the factors?
Well, I could take a bit of a crack at it, but I think you would be very interested to hear President Obed's response. I think some of it has to do with the things that we've been talking about in terms of our relationship with Indigenous peoples writ large. And one of the things that you heard the Prime Minister talk about recently is the work around the recognition and implementation of rights. And I think it's fair to say that we have lived in a world of denial of the rights of Indigenous peoples. We have had policies and practices in this country that have led to these conditions, including things like residential schools, including mass relocation, in moving entire communities, and the disruption that causes to families, allowing severe rates of overcrowding, not addressing the human resources gaps, and essentially living in denial and turning a blind eye to the inequities that exist in our country. But that is, we would all agree, is unacceptable. This is entirely a solvable issue, and we have to take a new approach. And I really encourage you to hear President Obed's more eloquent response to how we got into the circumstances we're in.
Minister, can I ask you about, you talk about a lack of housing, and poverty as being some of the underlying issues. So what part of this strategy addresses that, and how long a process will that be?
Well, unfortunately, the housing piece is probably one of the pieces that will take the longest time to address. But having said that, in the budget, there is now long-term commitment over the next 10 years of $40 million per year to address housing. And in the communities across Nunangat, there are housing developments that are happening in Nain, this community we were speaking of recently. When we visited recently, I got to see a lovely sixplex that's being built there. And so we are seeing that the housing issues are being addressed. One of the things that the task force can do is actually look at where overcrowding rates are the most severe and match that with the maps around the tuberculosis rates, and in fact use the work of the task force to inform the housing strategy, so that not everyone will be able to be housed in the most spacious place in the next year or two, but when I say we, I'm talking about the team that's working together, led by Inuit leaders like President Obed, will make decisions around where those houses need to go most quickly in order to support not only the general housing needs, but to address tuberculosis.
Minister, you say that the housing issue is being addressed, but multiple Indigenous leaders, including the Ontario Regional Chief Isidore Day, pointed out that the amount of money put in the budget was not sufficient to address the issue. How do you respond to that?
beyond the Inuit issue here, but I will briefly say that we acknowledge that there's much more that needs to be done on housing. The investments that have taken place for housing for First Nations, Inuit, and Métis in the last 3 years are historic. As it relates to First Nations, we have $200 million per year for the next 3 years in the budget, with an acknowledgement that we need to work on a specific housing strategy. There's a housing strategy being developed for Inuit, for Métis, and for First Nations, but it's going to take more than money. It's going to take much better creativity in the design, in the funding models in order for people to be able to have perhaps different ownership arrangements of housing. And this will be one of our priority issues over the next year to support our partners in responding to the housing crisis.
We have time for one more question for Minister Philpott before she has to head out, but I would encourage everyone to continue asking to the ITPA as well.
What's more challenging, this or providing clean drinking water to remote First Nations communities?
I don't know that it's a fair. I don't know that it would be wise for me to answer that. You don't necessarily want to compare challenges. This is addressing the elimination of tuberculosis is complicated, but it's not rocket science. You know, we're in a position where we have the best technical and diagnostics tools that have ever been in existence, where we can get digital x-rays into some of the most remote parts of Canada, and even if there's not a radiologist there, those images can be sent out elsewhere. We have this gene expert technology that can give you an accurate molecular based diagnosis in 2 hours, compared to sending off sputum samples for acid fast bacilli staining that would have taken weeks to get a response back. We've got this new treatment for latent TB, which we believe in tests that Dr. Alvarez and others have done will actually increase compliance rates. So from a medical point of view, we've never been in a better situation. But it is going to be really the biggest challenges in responding to this are the socioeconomic challenges, and I include in that the stigma that's associated with tuberculosis, and we cannot underestimate how significant that is, and President Obed will tell you that there's possibly no Inuit family that hasn't in some way been touched within their extended family by tuberculosis, and has a story of someone who was sent away, loved ones who were lost. And there's still fear. And so those kinds of things take a lot of work, but we are really encouraged by the progress. I think both President Obed and I and our partners in the provinces and territories and others really believe that we've collectively got the political will that has perhaps not been there for some time, and that is absolutely an essential part of this as well. And with that, I will ask to be excused, and I encourage you to speak to some of the others that are here today. Merci beaucoup. Thank you.
Could you talk a bit about how we got to this point, kind of charting that path, and also a bit about the stigma behind TB and the challenge that poses?
Many Inuit in Inuit Nunangat, our homeland, live seasonally and didn't move into communities until Inuit were coerced or sometimes forced or relocated into communities in the late 1940s to the early 1960s. When Inuit moved into sort of these what you would call Canadian style of living in one particular place in a house, and did not move seasonally or use our traditional housing, we were provided with substandard housing, and we were provided with inadequate and not enough housing. So our overcrowding rates and all of the social impacts, and specifically in relation to this, the higher prevalence of tuberculosis and other communicable diseases, first had a huge impact on us because of these policies by the Canadian government in a post-World War II era, where Canada wanted to assert sovereignty. Canada recognized that it had fiduciary responsibilities to Inuit that it had not necessarily recognized in the past, and the idea of sort of control over our lives was still in the forefront of the imagination of policy responses. So that's how you get large rates of tuberculosis and then treatment of tuberculosis that involved disrespecting our human rights. So taking family members forcibly away from communities to be put in sanatoria in the south. Some Inuit were returned to the wrong communities. When Inuit died, many of those deaths were not recorded and were not told to family members or loved ones. Mothers were taken away from their babies. These were federal government processes that affected us in huge ways, that still affect not only this issue today, but also the way in which Inuit work with the government, not just in relation to tuberculosis and screening and care for tuberculosis, but also just in a general relationship sense. This is the relationship that we are hoping to repair today. So over time, tuberculosis rates were always elevated in relation to the Canadian population. Minister Philpott talked about TB rates declining in the 1970s and 80s, but TB rates were always at least 25 to 30 times the TB rates of non-Indigenous Canadians. So it also speaks to the social inequities in this country, and especially in relation to public policy. If there were outbreaks of tuberculosis in a comparable southern Canadian town or city, there would have been a coordinated response from the federal government and the jurisdictions involved in a proactive, priority way. And for us, we have gone decades saying that we need help, but receiving little to no funds in response. So the TB work that has been done in Inuit Nunangat is largely in the methodology of TB control. So recognizing active cases and then doing contact tracing within communities, and then hoping that there won't be more active cases that have to be serviced in communities. This is now the first time that the Government of Canada is saying that TB control is not enough. It's just managing the elevated rate of tuberculosis in Inuit Nunangat is not enough. And it's going to be a challenge for the health systems involved, for the federal government, and especially the finances involved in working on this. And I'm encouraged by Minister Philpott and the Budget 2018 announcements, which are Inuit specific in relation to housing and in relation to tuberculosis. But it is the start of a longer journey, and one that we need the rest of Canada to come along with us.
President Obed, again, this incident happened in Maine. Would you say this death is probably due to stigma rather than a misdiagnosis?
I don't want to speculate on the circumstances of this particular case. My heart goes out to the family of the young boy who had died. There is widespread stigma in relation to tuberculosis and how it exists in our communities. There still is a lot that we need to know, a lot of public health communication efforts that we will have to do in coordination with treatment and screening and the proactive work on the social determinants of health. Because still in our communities in this day, many people don't want to naturally go to a health center to get care, have had terrible experiences with the healthcare systems, or don't understand the risks involved in relation to tuberculosis. And we as Inuit often will go see a nurse, not go see a doctor when we go to health services. We have 51 communities across Inuit Nunangat. There are 4 that have hospitals within their communities, so is only possible in 4 of our 51 communities to see a doctor if there is a health emergency. So in many cases, Inuit are referred from health centers, which are staffed by nurses, to regional centers. This is another way in which the care and treatment of a disease like tuberculosis can be misdiagnosed or missed, or it could be a result also of people not trusting in a health system enough to be able to go to receive care.
So the rates of tuberculosis have been, trending upwards. Could you tell us a little bit about why that may have been happening in recent years?
Well, in relation to our social determinants of health, there are a number of factors, whether it's poverty. Our median income in Inuit Nunangat is around $23,000. The median income for non-Inuit who live in Inuit Nunangat is roughly $70,000 higher, about $93,000. So we have widespread poverty in our communities. We know the food insecurity rates in our communities are 70%. We know that the overcrowding rates in Inuit Nunangat are 52% in relation to 9% for the rest of the population. These all are very clear indicators of why TB is widespread in our communities. That, coupled with the lack of access to care, especially primary health care services, and then the associated follow-up services in relation to the health system, create a scenario in which tuberculosis, which is already entrenched within our population in many ways, because many people would have had latent TB or have been exposed to TB even as infants or young children. It provides a scenario in which active TB can spread more readily than in a general population in this country where there is no overarching risk of tuberculosis because there is an exposure on a daily or regular level within that population.
But if you permit the question, do you personally have any connection to TB in ways it's affected your life or those of your loved ones?
Well, just in Nain, we had our 2017 annual general meeting, and we also had an Inuit Crown Partnership Committee meeting, and we were listening to the brass band, and the brass band is an interesting part of our colonial history. We were colonized and enunciated by Moravians in the 1700s, and we created a unique musical tradition that was lost in the 1980s, but has been brought back in a very successful degree, and by some of my close friends and relatives. But one of the members of the brass band, my cousin, had passed away from tuberculosis just a couple of years ago, and his sister was crying next to me and next to Minister Philpott, and Mr. Philpott asked why, and she told him because her brother wasn't there to play as well, and she was missing him. So we all have stories about loved ones that we've lost and people that we're very close to that have died of tuberculosis, and so that story is not a historical story from the 1940s. This is something that is touching us to our very core even today in 2018. Thank you very much. As Minister Philpott had mentioned, we do have experts here as well to be able to answer any additional questions you might have that are specific to the TB task force and also the way in which TB has propagated or exists within Inuit Nunangat. Nakonik.
Oh, I know. That's happened to me before, though. I've been
Yeah, I suppose so.
and I'm just sitting there. Eventually, like, realize
Yeah.
yeah.